Eczema is common. Eczema affects 5 to 20% of children in Western Australia. That's up to 1 in 5 children, and this number is increasing. Eczema often runs in families, or other family members may suffer from related conditions such as allergies, asthma, or hay fever. You are not alone, and we are here to help guide you through your eczema journey. What causes eczema? This is complicated, so let's break it down. Human skin is an organ, just like the heart and lungs. In fact, the skin is the largest organ in the body. Skin protects our bodies from the outside world. It stops irritants, bacteria, and allergens, such as pollens and food particles, from entering the body. It also prevents water loss. In patients with eczema, the skin lacks certain proteins and natural moisturising factors, causing this protective barrier to be fragile. Breaks or cracks develop, allowing bacteria and allergens in and moisture out. This results in dryness and inflammation of the skin and increases the risk of infection. The immune system of a child with eczema reacts more easily to everyday things in our environment that are usually harmless. The inflammation and dryness makes the skin itchy, resulting in scratching, which further damages the skin. And this cycle continues. The result of all of this are the features of eczema you see in your child: dry, itchy, red, inflamed skin. This cycle continues unless we break it with good, effective, and consistent eczema management. Things like grass and sand can cause irritation and itching, but kids love playing outside. Where possible, let your kids be kids, but follow messy or dirty play with a cool bath to wash these irritants off. Bath or shower once a day when possible for no more than 10 minutes. Keep water lukewarm to avoid overheating, which can make your child's skin itchy. Avoid soap and bubble bath, as these remove natural oils from the skin, worsening dryness. If the skin is dry, some doctors might recommend adding bath oil to the water. If you decide to do this, use dispersible bath oil. This is the one that makes the bath water milky. When getting out of the bath, pat dry the skin. If you can see any eczema, apply topical corticosteroid to all affected, rough, red, inflamed areas. Applying moisturising cream head to toe whilst the skin is damp. This helps with absorption and limits greasiness. It is important to use plenty. Even when there is no eczema present, it is important to moisturise the whole body every day. We recommend moisturising twice a day and more often if the skin is really dry. Why is moisturising so important? Moisturising helps to strengthen the skin, filling in the gaps, ensuring this important protective barrier is not damaged. Moisturising even when the skin looks clear is so important. If you don't moisturise the skin, it will become dry, creating a damaged top layer that over time will become more damaged and cracked. Itching will worsen the damage, and then inflammation occurs, resulting in an eczema flare-up. Although in theory this sounds simple, choosing the right moisturiser is complicated due to the sheer magnitude of products available. Choosing the correct type of moisturisers is essential. Moisturisers are also called emollients. Choosing a moisturiser that is a cream base or an ointment, either in a tub or a tube. Avoid lotions as they contain lots of water and not much oil, and are often not moisturising enough for most babies and children with eczema. Moisturising creams improve skin hydration and are excellent for everyday use. Sometimes creams can sting eczema areas. Ointments are better in this case. Ointment moisturisers provide an excellent barrier for the skin, but they are thicker and greasier and not always liked by the child. Once the eczema has cleared, the child can use a cream again. The thicker the cream, the longer it lasts on the skin. As a general rule, brand and cost does not matter. Simple, inexpensive preparations are often as effective as expensive or compounded preparations. Keep in mind that you might need to try a few different ones to find the one that works best for you and your child. Topical corticosteroid ointments are needed for any area of eczema that is inflamed, red, rough, and itchy. They dampen the immune response and decrease inflammation, allowing the skin to heal. Corticosteroid fear or phobia is common, and most people don't use enough and don't use it for long enough. This results in eczema that is not managed well, and a result never completely clears. Effective use of topical corticosteroids outweighs the alternative, which is chronic skin inflammation, infection, and potential long-term behavioural and psychological problems, as well as poor growth. So, how do you use topical corticosteroid appropriately? Your doctor will prescribe your child the appropriate topical corticosteroid strength and type, depending on the area of the body affected. After the child has a soap-free, short bath, pat them dry with a soft towel. Apply topical corticosteroid to all the affected eczema areas, not just the worst parts. Do this while the skin is damp to help absorption. Use enough to completely cover all the eczema areas you can see and feel, including the dry, rough, red, itchy areas. It is safe to use topical corticosteroid on the open, weeping areas of eczema. Apply topical corticosteroid once a day, unless advised otherwise by your doctor. To all the other areas of skin, use plenty of moisturiser. You should continue to apply topical corticosteroid once a day to all the affected areas until the eczema has completely gone. This typically takes 7 to 14 days. If the eczema is not completely clear after 14 days, ask yourself, are you using enough? If so, then you need to see your doctor to ensure you have the right strength of topical corticosteroid and to rule out infection. Once the skin is clear, stop the topical corticosteroid but continue bathing and moisturising every day to prevent flare-ups of eczema. Flare-ups of eczema will occur, and you'll need to restart the topical corticosteroid at this time. It is very important to start treating these areas as soon as they flare. Remember, apply topical corticosteroid daily after bathing to damp skin. Use enough to cover every bit of eczema. Continue each day until the eczema is completely clear. Apply plenty of moisturiser to the whole body twice a day. Continue even when there is no eczema. Always avoid triggers where possible. Please refer to your pamphlet for daily reminders of eczema management. If you have any questions about your child's eczema, please see your doctor.